Coming up, we'll be on location at Tyson's West Orthodontics and Pediatric Dentistry, discussing the latest advances in pediatric dentistry and how they can help your children get a beautiful and healthy smile with one of this area's top pediatric dentists, Dr. Reem Alhussain. Welcome, Dr. Reem, to the Top Doctors Interviews program.
Thank you so much. Thank you.
All right, it's great to have you on to educate the community. We're here to talk about pediatric dentistry. And on that note, I wanted to begin by asking you if you could please tell us what pediatric dentistry is for people that don't know.
Yeah, that's a great question. So pediatric dentistry is really the specialty focused on providing oral health care specifically for infants and children through adolescence. So we really focus on comprehensive care, and that includes both preventative and therapeutic approaches.
Oh, that's great. And what would you say are the key differences between pediatric dentistry and general or family dentistry?
That's a great question as well, because really both general dentists and pediatric dentists both obtain a doctoral degree in dentistry. So you can have either a DDS, a Doctor of Dental Surgery, or a DMD, a Doctor of Medicine in Dentistry. But after that, you can do additional training. So as a pediatric dentist, you could do 2 to 3 years of additional training in specific disciplines of pediatric dentistry. So we go into disciplines including behavior guidance, we do sedation, prevention of caries, we do hospital dentistry, and really a lot of it is geared on behavior management and coordinating and managing medically compromised patients and patients with special needs. So all that really encompasses the scope of pediatric dentistry.
So it seems like pediatric dentistry is really geared toward and focused on taking care of children and accommodating to their needs, as opposed to family and general dentistry, which is pretty much for most people.
Exactly. So just like you would really take your child to see a pediatrician, you would take your child to see a pediatric dentist. So most people don't take their, child to see their primary care physician per se. And that's really because all of our equipment is geared toward children. Even the tools that we use are even smaller. Like for example, our x-rays, we use sensors that are size 0, where you might not find that in a general dental office. Even, our staff, they're all trained to be kids expert. We use specific terminology for kids to ease their anxiety, and really it's just not about just treating that mouth, but treating that person that has that mouth.
So what would you say, Dr. Reem, are the key benefits of taking your children to a pediatric dentist as opposed to going to a general or family dentist?
Of course. So in addition to the specific equipment that we have that are geared specifically to children, we really focus on creating the ideal environment for a child. So our offices are often very kid-friendly, and we do a lot of games and contests, and that really excites the child to come to the dental visit. I mean, when I have a fearful child come in and they leave for that appointment happy with a smile, I feel like we scored a win that day. And it's really because we addressed that child's specific needs. Every child is completely different. Even within a family, we'll see siblings that are completely different. So we catered unique approaches for these kids, and our dental hygienists are equipped that way too, and are trained that way, and our dental assistants, and so everybody really is on board for that. We also are very big on positive reinforcement, and we do reward system for kids. So all of that is geared towards just making that visit a really fun visit, and then they're more likely to have a positive relationship with their dental care, and then they have a good dental home established from a young age, and they have a great relationship with their teeth for the rest of their life.
So those are some major benefits for children, because we know that going to the dentist can be a scary or nervous type of experience for people, especially for children. So when they can come into a practice like yours that's really beautiful and so welcoming for children, and it really takes it to the next level to where children can have a positive experience at the dentist, which really sets their track and feelings towards dentistry for the rest of their life.
Exactly. And often, we'll have parents who remember having a negative a traumatic experience when they're younger, and they have a hard time going to their dentist till adulthood because of that. So they make sure that, you know, they bring their child early on to establish a good relationship with their dentist from a young age and establish just good habits where they don't have that trauma.
That's a very good point.
Yeah.
Now, what would you say, Dr. Reem, are some of the most common or typical problems that you see with children and their oral health?
Yeah. So in fact, dental decay is actually the most common disease in childhood. So in general, tooth decay actually is 5 times more common than asthma. And you know, we think of so many kids having asthma, 5 times more than that. And what's really appalling too is 44% of kids in the US actually suffer from dental diseases before kindergarten. So it actually affects the quality of life for children from a young age. And you know, when a child is in pain, when a child can't eat properly, that affects their oral, not only their oral health, but their overall health. You know, we have a lot of studies that show that early childhood caries is associated with having deficiency in iron. They have iron deficiency, they have anemia, they even affect their malnutrition, their just in general nutrition, their self-esteem. They're missing a lot of school time. You know, when you have decay, sometimes it's visible. You know, kids are not the nicest sometimes and they bully each other. So it really just affects their overall well-being.
What are some of the most effective treatment options to address the decay and those problems you mentioned?
Of course. So really when we look at kids who have cavities, there are so many different things that we're looking at, not just clinically and radiographically through x-rays, but we're also looking at the extent of the cavity. We're also looking at the behavior of the child. We're looking at the medical needs of the child. All that together really helps us create a treatment plan that's best fit. And of course, with the parents, I always, you know, trust the parents because they know their child best, and they sometimes will let us know of certain things that work best, and it really does help a lot. So just taking all these factors in together really help us create the best approach. So we can use, for example, for a younger child, we might create a treatment plan that's a little non-invasive. So more minimally invasive dentistry. So we have methods like silver diamine fluoride, which is a medication that we apply on the teeth that helps the cavities arrest the progression of the cavity. So it helps, instead of a cavity getting bigger with time, it really helps us buy time by making sure the cavity doesn't get worse until we can do more definitive treatment later on with, for example, a restoration like a filling or a crown if that's needed, or even sometimes if the tooth is very infected, we need to extract and remove the tooth.
So you really work as a partnership with each parent, knowing that the parent knows their children best and what their teeth are like, what they eat, all their background information, in order to put the best plan together to make the most effective outcome for each patient and each child.
Exactly. It's very much a comprehensive approach.
Now, Dr. Reem, how often would you recommend parents bring their children to a pediatric dentist like yourself?
Yeah, so usually the checkups, we say every 6 months for a child to come in, do preventative care where we do a cleaning, we take x-rays, we take a look at the mouth. Of course, that might be different for every child. So children, for example, like I see a lot of children with special needs. So let's say I'm seeing a child who is autistic. I might see them every 3 months per se, just because brushing, oral hygiene habits at home might be difficult. So then we're monitoring it more closely on a 3-month basis. So really it depends on every child, but the general rule is every 6 months, and then your pediatric dentist will let you know if your child is at a higher cavity risk or a lower cavity risk, then that sometimes can be altered differently.
Oh, that's very good to know. Yeah. A lot of parents are kind of out in the wild. They don't know really what age to bring their children to a pediatric dentist to, and there's so much we don't know as parents, or having children for the first time. No one teaches us this information. Yeah. So that's why I'm really happy that we're having this interview, Dr. Reem, so you can help inform a lot of parents and give them the guidance that they need to make informed decisions regarding their children's oral health. Can you please begin by telling us what age is appropriate And I know it could vary for each child, but typically to bring your child to a pediatric dentist?
Yeah. So the American Academy of Pediatric Dentistry and the American Academy of Pediatrics recommend by their first birthday. So usually at age 1, that's when we really recommend for them to come in and establish what we call a dental home. And what I always like to emphasize is that baby teeth are vulnerable to decay and cavities as soon as that baby tooth erupts. And usually that's as early as 6 months.
See, that's something that most people wouldn't know, that you can actually take your child to a pediatric dentist as early as 6 months. That's great to know.
Yeah.
Dr. Reem, when should children first begin brushing their teeth? What age would you recommend that to be?
That's a great question. So really when the first tooth erupts, that's when we should be brushing. Now, we recommend brushing with a small toothbrush, specifically for children and infants. Also, a soft bristled toothbrush is also very important. But really, as soon as that first tooth comes in, you can start brushing that tooth.
Oh, wow. And do you use toothpaste? Would you recommend using toothpaste, or is it just brushing without anything?
Yeah, so it's definitely okay to use toothpaste, but there's definitely recommendations with that. So under 3 years of age, you want to use about a smear size or a rice size of toothpaste. And then over 3 years, you can transition to a pea size. And the reason we say that is because, younger than 3, children are not necessarily having that swallowing reflex developed yet. So it's okay if they swallow a little bit of that toothpaste. However, we have some children that, will swallow the whole toothpaste. And if as a parent you feel more comfortable, then I always recommend you can start with a training toothpaste and then transition to a fluoridated toothpaste.
We all know that kids love candy and desserts and cake, and we just love sugar. Even as adults, we love sugar. So for parents that are first time with children or new parents, what advice would you give them related to their diet or their consumption of sugar for their children?
Yeah, that's a really good point. I mean, I always tell the kids this. I was like, do you know who also really likes candy and sugar? Dr. Reem does. It's something that it's incorporated in our life, but it's about moderation and how can we have good, healthy habits from a young age. One of the biggest things I always emphasize to parents is what we drink, because that really plays a big role, not just oral health, but also our overall body. So water, drink water often. Have your kids get used to drinking water often. After mealtime, after snack time, just drinking water is just really a great habit to develop from a young age. And then we have the milk. Milk also, I encourage, kids to be drinking milk often, but it's important to realize that has to be from an open cup. When you put milk in a bottle and they go to sleep with that bottle, that definitely increases the chances of getting cavities. So where you put the drink also makes a difference. Also with juice, that's another big one. Often you go to the grocery store and you see 100% juice and it's labeled as healthy and organic, but it's important to also realize that they do not have added sugars, but they contain a lot of sugars. That pouch of juice that you see, 100% juice, has 9 grams of sugar. That's still a lot of sugar to be consuming on a long period of time. So that's why I always say if they're having their juice, limit it to 4 to 6 ounces and have it during mealtime so that they're not sipping throughout the day with, the juice.
That's very valuable advice, and prevention is the key to helping problems from occurring, because dealing with those problems after they occur is always more difficult. So if you can take preventative steps, it's always advice that's well taken by people. So can you tell us what guidance or advice you give to parents to take preventative measures so they can stop oral issues from arising, like tooth decay and things like that?
Yeah. So 1, shop smart. I always say when you're stocking your pantry, stock it with not the sugars and the starches. I mean, keep those for special occasions and teach your kid to have a balanced diet from a young age. Good oral hygiene habits. That means brushing every day for 2 minutes a day. Brushing every day 2 times a day, each for 2 minutes, with a fluoridated toothpaste. And also before age 8, children don't really have the manual dexterity to brush properly. So I always say to have supervised brushing until that age. Another thing that's really important in addition to the balanced diet and oral hygiene habits is establishing a dental home, meaning from a young age, from age 1, that child is used to going every 6 months to the dentist and is practicing preventative care, seeing their dentists for any dental problems. So that's really important too.
That's great advice and very helpful for parents because these are questions that they have, but they just don't know the answer. So we're very fortunate to be here today at your practice to educate the community.
Of course, thank you. I'm really big on education. Education is key to solving any problem.
Yes, it is, absolutely. Dr. Reem, Tyson's West Orthodontics and Children's Dentistry is one of the few practices throughout the entire region that's really geared towards taking care of and helping children with special needs. Can you tell us a little bit more about what special needs dentistry is like for children?
Of course. So special needs dentistry really focuses on individuals that have cognitive impairment, developmental delays, it can be speech delays, it can be really any medically compromised condition. And to really be able to treat these individuals, we have specialized programs and specialized tools to be able to do that.
Yeah, because we know that going to a dentist can be a nerve-wracking experience for adults, children, for everyone. And then when you have or compound that with special needs situations where you're challenged in certain ways, that can really make it even more difficult. And we know that children face a lot of different challenges. What are the most common challenges that children face that have special needs when they're coming to a dental practice?
Yeah, so really, unfortunately, one of the biggest obstacles with special needs dentistry is just access to care. Because there aren't many trained individuals in special care dentistry, there's just a limited access to going to these clinics. So a lot of these clinics are not equipped to see children with Down syndrome, autism, ADHD, cerebral palsy. These are the most common ones that we often see. And to have the available equipment, the techniques. For example, we're big on desensitization techniques. You know, sometimes that means just bringing a child where he's just kind of doing a visit overall to the practice, kind of getting used to the different personnels, and we don't really do anything in that visit. And that's an okay approach, where in a more traditional dental setting, that's not heard of. We don't do that. I remember we had a child come in. He was about 15 years of age, and he had autism. And we couldn't even get him to open his mouth. I mean, we focused on bringing him to the same room, operatory, so that he was familiar in that room. We made sure that room didn't have a lot of bright colors or any triggers. We didn't use the light, because sometimes even sensory things can trigger different reactions. And with time, we found out that if we did the treatment on the floor, not on the chair, we were able to do everything. So it's really just thinking outside the box and really being able to accomplish what you need and focusing on the unique needs of that special needs child.
That's really great to know, because there's so many parents that deal with these situations where their children have special needs, and most dental practices really are not equipped to handle that, and it becomes a very traumatic experience for those children, a difficult situation for the parents as well. So to have a practice like yours that's really geared and equipped towards addressing the oral health needs for children that have special needs is a really great benefit. Dr. Reem, is there special training that's necessary or additional certifications when you're dealing with people with special needs children to provide the best dental experience and the best oral health?
Yes, as a pediatric dentist, it's actually part of your residency training, not only to train to see children, but also kids with special needs. So that being said, we do also a lot of behavior management techniques, how to better deal with those special needs patients. We do behavior guidance. We do hospital dentistry and sedation. So hospital dentistry is really basically general anesthesia, and we often do that in a hospital setting because it's just a safer setting, especially because a lot of these kids have other systemic health issues that we want to monitor. I personally do that at Inova Health Systems. We have hospital privileges there, and we work with a really great anesthesia team, and the parents feel safe about it, and we are very happy with the treatment that we do there, and it works out really well.
Well, that's great to know, because this way parents can know that there's a place, and that's here at Tyson's West Orthodontics and Children's Dentistry, where they can come with their children that have special needs with the different types of health issues or issues that they may be dealing with, and you can really accommodate those children and provide the best experience and dental health for them as well. So that's great to know. Is there any advice or recommendations that you have for parents when they're dealing with children that have special needs?
Yes, actually, I very much do, and that is just establishing a dental home early on for that child. When that child, comes in early and they get used to that pediatric dentist and they're used to this clinic, and they're constantly going there every few months, it really establishes such a great relationship between the dentist and the patient, and that really goes a long way. Of course, with less anxiety, cooperation becomes better. We're able to do more treatment, and really focusing on preventative strategies, meaning really doing as much as you can, although I completely understand, the difficulties with oral hygiene habits, even for a child, so imagine with someone with special needs. So trying to really do your very best with diet and brushing and using a fluoridated toothpaste and just keeping up with those dental appointments.
Well, that's very valuable advice, and we really thank you so much for joining us today, Dr. Reem, for helping so many parents out there make informed decisions regarding their children and their oral health and dentistry. It's been great having you on the program, and we'd love to have you back in the future.
Thank you so much. I really enjoyed this as well.
All right, thanks again.
My grandma was a patient for 18 years, and we came here because she recommended it for us. I had an expander and I had braces twice. They were good. They worked out perfectly. I worked with both of them. Dr. Al did a great job. I was happy with the results. They make sure everything's right and all that, and I really enjoy coming here. I would recommend it because their customer service is good, and whenever I come here to get braces or get an expander, anything, any treatment, it works out perfectly in the end.
I came to see Dr. Al, and he did my braces and he did my expander. I really like coming here because the people are very nice, and it really helps my teeth. These prize cards have points on them, and then how much you have, you can get a prize. And I got this prize right here. I really like the prize system that they have here. I recommend this place because they make me feel really comfortable.
We had shopped around for several dentists, and my one son had several fillings that needed to be done, and I wanted some second opinions, and when we came to Tyson's West, they were so accommodating, and it was the first time that my son had successfully fit that little piece in his mouth that did the x-rays without gagging, and it was excellent, and we've never looked back.
The experience was great. One of the things I love about Tyson's West Orthodontics is the aesthetics. I think it's really nice here. The environment's really welcoming, and it's very warm, and the staff is extremely friendly, and the technology is best in class. So I feel very confident whenever I send my kids here that they're going to be get the best treatment possible.
The results have been excellent. My son had to have a bunch of cavities filled, one of which needed to be a silver cap, and it was a pretty big procedure, and Dr. Reem took more than enough time, was extra patient and gentle and kind to make sure that he had no pain, and took care of everything, and since then he's been great.
Like I said, Tyson's West Orthodontics is a great place to send your kids. Like I said, the staff, they're experienced, they're knowledgeable, they're friendly. very patient with the kids. They have things set up inside the office to help the kids, feel more comfortable. The results for my daughter have been incredible. She got braces within a couple months. I think the gap in between her two teeth already started to close. So I'm blown away with just how quickly the results have come in already. And she's how much longer does she have?
6 or 8 months.
Yes,
to go.
6 to 8 months to go. It looks great.
We were looking for a dentist, so my dad called and we went in, and ever since then I've loved it. And then maybe like 6 months or a year after, they recommended braces, and I've had braces for like 5 months. I love coming in. Everybody's so cheery and welcoming, and I love all the staff, and Dr. Reem is super nice. I would recommend Tyson's West Orthodontics because they do a really good job, and I've loved the results of having braces, and it's only been little time, but I think they look really good.
I like coming here because everybody's very nice and it's very fun. And the prizes are very cool. And whenever you go to the dentist, you get these points, things and stuff, so you can get the prizes, and it's very fun. There's footballs and there's Legos and there's all these type of stuff that are cool. That's why I love Tyson West Orthodontist. I got my braces here and everything is going great. Dr. Al and Dr. Reem are really nice and they make me feel comfortable and they really help me get a great smile. I got my x-ray and my teeth cleaning and I have no cavities. She helps me with my teeth and it really helps, and I love going to the dentist, and I really like the prize system. You get prizes and stuff and all sorts of kinds of toys. I get prizes when I take care of my teeth. We really recommend Dr. Reem and Dr. Al.
My dentist from in Arlington, she recommended this dentist to my parents, and my parents brought me here, and I'm very lucky that they did. I got my braces done by Dr. Al, and I got my cavity filled by Dr. Reem. I really liked it. They were really nice people, very clean place, and a really nice place. I like how modern it is, and I like everything. It's really nice. They did a really good job with my teeth. I was really comfortable when I was laying up and they were putting my braces, and I really liked it. Because they're really nice people. They did a really good job, and I think more people should come here.